In this video, we'll discuss about asthma. Respiratory tract start with the nose, leading to nasopharynx, pharynx leading to larynx, leading to trachea. The trachea will divided into two bronchi. The principal bronchi, right and left principal bronchi. The bronchi will divided into bronchioles, primary, secondary, tertiary bronchioles, finally reach to terminal bronchioles. Then terminal bronchioles leads to respiratory bronchioles. It leads to alveolar duct and alveolar shock. This is the entire respiratory tract. Three things: this respiratory bronchioles, alveolar duct and alveolar shock, considered as sinus. Sinus is these three things. Sinus is the structural and functional unit of lungs. So this is entire respiratory tract. Introduction. Some people have very over sensitive respiratory tract. Whenever any particular stimulus enter in that trachea and bronchi, okay, so trachea and bronchi undergoing spasm. The stimulus can be different for different people. Some people, the stimulus is dust. Whenever they come in contact with dust, they inhale dust. They have attack of asthma. Some people, the stimulus can be pollen grains. Particular pollen in a particular season. Whenever a particular pollen present in that atmosphere from that flower, the person have the attack of asthma in that particular season. That is why it may be seasonal. It can be any chemicals which is presented in that air, any pollutant which is presented in that air. Whenever particular person come in contact with a particular stimulus from which that particular person is sensitive, when inhale the dust enter, basically it is a disease of trachea and bronchi. So it is a disease of trachea and bronchi. Whenever the dust particles reach that trachea and bronchi, it undergo spasm. It is the productive mechanism. So by undergoing spasm, the trachea and bronchi undergoing spasm, it is prevent that entry of that particular stimulus, that the dust particles into that lower respiratory tract does not enter inside, but air will also not go inside. So the person have dyspnea, person have cough, so that is the attack of asthma. So the asthma, there is over responsiveness of that respiratory tract in some individuals. Over responsiveness of some individual to a particular stimulus. Normal person dust enter means macrophages help them. Whenever the same dust particles or stimulus, maybe it is grains or pollen or chemical or dust, it going inside that asthmatic patient. So this one is the normal, this one is the normal one, this one is the trachea. So here it going to spasm compared to trachea. This one is the normal, this one is the trachea spasm. It is the disease of trachea and bronchi. Because of that, patient have dyspnea, cough, and wheezing. So three disease together, three symptoms together known as asthma, because patient have spasm of the trachea and bronchi. Now to relieve that spasm after some time, okay, it relieves the spasm after sometimes, it automatically relieved or with the help of treatment, bronchodilator, the pump and that inhaler, it get relieved. So either medication it get relieved or automatically spontaneously after sometimes it get relieved. So that is a bronchospasm. So that asthma is not a continuous disease. It comes contact means, so when that person having contact with the stimulus, that time only it will come. So it have that name, paroxysmal disease. Whenever attack, that time the person having symptoms, attack time only they have symptoms, remaining normal only. So this disease name is called as paroxysmal, paraxy paroxysmal disease come in attack. So the disease is not constantly present all the time. The disease is not constant. Okay, not constant. It comes and attacks. So that asthma is the paroxysmal disease. So there is spasmodic narrowing, spasmodic narrowing of the trachea and bronchi, which is relieving either spontaneous after sometimes or with medication or therapy. So the spasm occur the level of the trachea and bronchi, and that etiology is that allergen. Different people having different allergen. The allergen, some people just for some of them are pollen grains. Some of the people having dust, some of the people having pollen grains, chemicals and pollutant. Asthma is a disease of trachea and bronchi. They undergo spasm whenever person inhaling that stimulus. The stimulus is going to inside and that particular person having particular stimulus. Next, what is pathogenesis? Asthma is an antigen. Asthma is an example of type 1 hypersensitivity reaction. That is allergen. As soon as that allergen it comes and contact with that person, so allergen it come and contact with the person. For example, that person allergy particles, whenever it inhale the dust enter to whenever inhaling the dust is going inside trachea and bronchi, first cell it comes under contact with antigen presenting cell. What does that antigen presenting cell will do? This antigen presenting cell will inhale that antigen. It will degrade that antigen into multiple pieces. It will process that antigen. First it will inhale, then it undergo, then it will process. After processing, it will present in that surface. It present. So antigen enter, antigen presenting cell is there. The next T helper 2 cell. The next cell T helper 2 cell stimulate and secreted chemicals. It is secreted chemicals which is cytokine, interleukin 3, interleukin 4, interleukin 5 and many chemicals are released. The most important one, interleukin 4. This interleukin 4 goes to that next cell and stimulate to that next cell. Here 5 cells will come in that row. First cell antigen presenting cell, second one is T helper cell, the next cell is the P lymphocytes. So here presented cell P lymphocytes. The B lymphocytes is converted into plasma cell. What does the plasma cell do? The plasma cell producing antibody. So this is start from that antibody, 5 different type of antibody: IgG, IgA, IgM, IgE, IgD. Here IgE antibody formation, the plasma cell forming IgE antibody. This will go to that antigen and form antigen antibody complex. So it will go to that antigen, it will form antigen antibody complex. There will be phagocytosis. This antigen is destroyed. First time there is no allergy. First time that antigen is destroyed. Um, Phagocytosis occur, antigen antibody complex are formed, antigen get destroyed, there is no problem. This was the first episode. The first antigen entering in that human, first time there is no allergy. The same antigen enter to that second time, second, third, fourth, at any time it will come under contact with the antigen presenting cell. It will antigen presenting cells will recognize. The body have that immunological memory, that the immunity have very strong memory. So this immunity will recognize it with that memory, that will you are the one for which we have already followed that process. So will not follow again. You directly go to your antibodies. This antibody will which are presented IgE antibody, which formed here, they will go and bind with the surface of that mast cell. So second time it will bind with the surface of that mast cell. They will remain in the blood. So this is the mast cell presented in the blood. These IgE antibody. So here IgE antibody which formed, they will bind the surface of the mast cell with the Fc portion. Okay, so like this Fc portion it can bind. They will remain in the blood forever. So this is known as sensitization. So when it will bind to that surface of the mast cell, that process name is called as sensitization. It occurred during the first time. Second time this antigen is entering this first time. Second time when that antigen, the same antigen enter second time onwards, so antibody will recognize that memory. The immunity memory will recognize it, that you are the one for which we have already contact the process once. Whether it will after many years also, the body will recognize it. They will not follow the process again. You will directly go to your antibody. This antibody diverted to its antibody, which are not free antibody. This antibody present on the surface of the mast cell. So antigen will go and bind with the surface of the mast cell, and the antigen will go and bind the surface of that antibody like this, and bind that surface of antibody like this. This antibody will get stimulate. This antibody will give signal to that mast cell. So it will give signal to that mast cell. Once the signal is delivered from that mast cell, the mast cell will ruptured. So this mast cell inside granules is there, it will ruptured. Yes, this is known as degranulation of that mast cell. The mast cell all contain granules. All these granules will come out. The granules will come out is known as mast cell lysis. When that mast cell releasing that granules, that process name is called as lysis, mast cell lysis or mast cell rupture and degranulation. The granules came out. Now what does these granules containing? It containing many things: leucoderine, prostaglandin, histamine, serotonin, platelet activating factor. It containing many things, but that asthma most important one, leucoderine. Now that leucoderine receptor presented over the leucoderine receptor is presented over the trachea and bronchi. Over the trachea and bronchi, receptor for leucoderine are present. So a person when and come and contact with the dust, the complete process will follow, and granulation will takes place, leucodarine will come in that blood. The leucodarine will go to its receptor and bind with the leucodarine receptor. This leucodarine which is coming out of the mast cell, it will go to its receptor which are present on the trachea and bronchi and causes bronchoconstriction. The person have attack of the asthma, so this is how asthma attack takes place. Whenever the person coming in contact with antigen, every time, second time onwards, third times also the same and things happen, fourth times also, every time the same things will happen. So asthma is a disease when which is come in attack with paroxysmal. This is the complete mechanism. The complete pathogenesis, type 1 hypersensitivity. We can revise it once. So this one is the pathogenesis statement form. During first time contact the host with that antigen. Antigen is captured. Their antigen presenting cell is there. Present T cell which differentiate into T helper cell from antigen presenting cell to T helper cell 2. The T helper 2 cell releasing interleukin 3, 4, 5. Interleukin 4 only is important for the type 1 hypersensitivity. It will activate B cell. B cell activate it. B cell activate and form IgE antibody. IgE antibody is formed. It will bind with that FC region of mast cell. Mast cell now fully sensitized for the next event. So up to this first event, second episode, during the second contact with the same antigen. So here what will happen, this IgE antibody on the surface of the mast cell basophil are activated. So this one will activated, it will cause a lysis of that mast cell. During this mast cell it will releasing chemicals. So because of that chemicals, bronchospasm, finally asthma will happen. Now there are two type of asthma: extrinsic asthma, intrinsic asthma. What are the mechanism? Type 1 hypersensitivity. All the things we discussed for extrinsic factor. Intrinsic factor, we don't know that mechanism. It is non-human mediated mechanism. We don't know that extract mechanism for that intrinsic asthma. Then here family history present, here absent, here allergic reaction, example here rhinitis, urticaria, eczema, here absent. Serum IgE level increases, here normal. Skin test positive, negative. Then example of disease: extrinsic factor, atopic or allergic asthma, occupational asthma, allergic bronchopulmonary aspergillosis. Here drugs, most commonly aspirin. Viral infection, cold exposure is then exercise induced asthma. These are the things non-human mechanism. Example for intrinsic asthma. Now coming to cross and microscopy. If the cross, you can see that lungs are over distented because air troughing. Now trachea undergo construction, the bronchi undergo construction, so air get trapped inside, air not come outside. Because of that air trapping, there is over distension of that lungs, and you can see that mucus black also. There is, because of sometimes over secretion is occurring. Because of over secretion of mucus, this one will happen. Over secretion blocked that lumen. So this one is the normal one. Here over secretion, it will block that lumen. So this is the normal trachea. This one is the asthmatic person, allergic person. When they come and contact with the antigen, the trachea undergo construction, so that lumen become like this. So this is trachea, a healthy, this one is the healthy individual, this one is the patient. Undergo construction, so lumen is filled with mucus. So although the trachea is very narrow because of the construction, so whenever lumen is remaining even after narrowing, it is also blacked by that secretion. Coming to microscopy, this is the microscopy of sputum, not trachea, not bronchi. This one is the microscopy of this one sputum. Now that asthma patient have cough, patient have tremendous cough. Whenever the patient is in attack of asthma, patient is keep on coughing. So that patient uh, cough, the sputum is coming. During that coughing time, sputum also will come. What we are going, we are collecting that sputum in a container, and then we ask that patient to collect sputum in a container. That sputum of that patient we take and make a slide, okay, make a smear on that, seeing that, observing that sputum in that microscopy. What does the sputum contain? That microscopy, the sputum of that patient with asthma, it will containing triple C. So triple C, what are the triple C? It containing Krugman spirals, Krugman spiral, then it contain Charcot Leyden crystal, then it containing Crayola bodies. So it containing what are the things? Krugman spiral, Charcot Leyden crystal and Crayola bodies. Triple C is present. What do you mean by that? What is the meaning of three things? The patient is coughing very vigorously during the attack of asthma. The patient is coughing. So degenerate cell of that lining. So here presented cell become degenerate. Degenerate cells of that lining will come into sputum. So here the sputum containing the degranulated cell. The degranulated cell which are coming from that lining. So you can see coming from that lining of that mucosa, they get degenerated because of vigorous coughing, and the degenerated cell are coming is known as, that cell name is called as Crayola bodies. So first Crayola bodies is degenerated cell from that mucus lining. So this Crayola bodies, that is the degenerated cell from that mucus lining, mucosa lining the respiratory tract. So this is that trachea bronchi disease one, okay. So there are lined by, so here there are lined by pseudo stratified coated columnar epithelium. If that patient is coughing very vigorously, so the cell get degenerated and come out sputum. This one is the number one. Number two, inside of that single cell, complete strip also dislodged, okay, not only single cell, complete strip, that complete strip also dislodged and come into that mucosa. So sometimes the sputum you get complete strip of that big long strip of that mucosa lining, that is known as Krugman spiral. So here what will happen? Complete strip, that complete strip will come, that one name is called as Krugman spiral. So we can see Crayola bodies. What is Crayola bodies? Single ciliated columnar cell. Single ciliated columnar cell name is called as this Cleova bodies. So single ciliated columnar cells which is sludded off because of zinc. What is that? Korkman spiral. The respiratory epithelium which are twisted in the diagnosis. Also you can see Korkman spiral, twisted strip of that mucosa. So that sputum, a diamond shaped crystal also present. Diamond shaped crystal are formed that are known as charcoal laden crystal. So here diamond shape name is called as charcoal laden crystal. There are due to eosinophilia. So some eosinophils also presented. Due to eosinophilia, the diamond shaped crystal also formed, that is known as charcoal laden crystal. So the Krickman spiral presented, then charcoal laden, the diamond shaped cell also presented, Crayola bodies also presented. After that, coming to clinical features, it is triad, then dyspnea, breathing problem, that patient having cough, then very narrow trachea, so sound also will come wheezing. This video discussed introduction, pathogenesis, diagram, why this one happened, because of type 1 hypersensitivity reaction, then types of extrinsic and intrinsic asthma, then cross microscopic observation and clinical picture discussed. Thanks for watching.